Hello, everyone, and thank you so much for joining me. As Deirdre said, I am a physiotherapist specializing in migraine, and my background is chartered physiotherapy. So I have a headache and migraine clinic in Oranmore. Professionally trained PhD in physiotherapy through UL, and I also work as a sleep consultant then with Sport Ireland Institute. Um, in the lived experience of migraine, I have migraine myself, which has changed over my life and trying to navigate that. My husband has migraine, my mother has migraine. So I see a lot from that personal lived experience of it as well. And I hope that this talk will give you some context and some kind of ability to translate the research into the real world and how we can hopefully give you some tools to do that. So what I am going to cover tonight is how we can use exercise to help migraine and what specifics of that we can do. What type and amount is most effective? So how much do you need to be doing or is recommended for you to do in order to see an effect for that, particularly around the prevention of migraine, so decrease in migraine frequency, duration, and severity, and also about reducing that migraine burden in your life and improving your quality of life. I think a key part of this really is learning to understand what your migraine threshold is and navigate that line to overcome exercise as a trigger. Because for some people, exercise in itself can be a trigger for a migraine. So we need to learn how to walk that line. And I'm also going to talk on if you are looking at restarting an exercise program or just starting from the very beginning, or returning to exercise after being through a very bad bout of migraines back to back, or for some other reason that your poor health has impacted your ability to exercise. So I'm going to go through some tools that you can use for that as well. If you can see on the screen there, I'm also going to go through a case study as well of a patient of mine, 42-year-old mom of three. She's a teacher with episodic migraine. It recently started getting more frequent for her. She thinks in relation to a boot camp class that she started. And she's also complaining of neck and shoulder issues. Previously, she's been able to exercise with walking without any issues. So she's just trying to work that out. So we're going to talk through all of these points and then come back to Marie at the end, and I will talk you through how and physiotherapy tools and exercise as a tool can help people to do that. So why should we exercise for migraine? In the last 10 to 15 years, there has been an avalanche really of studies around this particular area, and that evidence has shown that exercise can be as effective as some of the top preventatives that we have for migraine. So particularly at reducing the migraine frequency. So that's the number of migraine or headache days per month. There's also evidence for it to reduce the duration of an attack. So that it could be reducing it by a number of hours, and also the severity of attack. And as I mentioned at the start, also to decrease that migraine burden and to help people improve their quality of life and locus of control around managing their migraine. I think what's important to note is that people with migraine are at a higher risk of other conditions. So they can be at a higher risk of anxiety, mood disorders, sleep disruption, cardiovascular risk, and overall bodily pain. Now, these can have a bidirectional relationship with migraine. So migraine can contribute to those things, and also those things can contribute to migraine. But exercise really is that crossover point because it is recommended as a management strategies for all of these factors. From the studies that we have seen, there can be significant decrease in migraine frequency of from 2 to 10 days less of migraine, depending on the number of migraine attacks that you are getting per month or headache days per month. And also significant improvement in the duration and severity of that. So moving on from here, as I said, there are hundreds of research studies at this stage on it, and what we want to try and understand, and what I'd hope to try and help you understand, is to understand what type of exercise you can choose from. In order to do that, I'd like to give you a little bit of a handle on what the terminology that's used in the research is. So first off is aerobic exercise. So aerobic exercise, you might have also heard it called cardio type exercise. So where there's an increase in your heart rate and respiratory rate for the duration of that exercise. So that could be something like walking, rowing, cycling, swimming, jogging, running, anything that's getting that heart rate up, climbing upstairs, downstairs, lots of things like that. It's then further divided into low intensity, moderate intensity, and high intensity. So how that is differentiated is the low intensity is in around up to about 60% of your heart rate max. Moderate intensity then is at about 70 to 75%, and high intensity is at that 90 to 95%. So it's important to note that because the different dosages of exercise can be more appropriate for different stages that you are at in a migraine attack and whether you have chronic or episodic migraine, and how you can make choices that are individual to you. And again, touching on, you've probably covered this in lots of other talks, but we would define chronic migraine as having more than 15 days per month with migraine or headache, or for some people, it's not headache, but other migraine symptoms. And episodic then will be in that 0 to 14 days per month. So moving on from there, this brings us into the clinical recommendations for migraine. My screen is a little bit covered here, but we'll navigate that. So group Latouche et al. Last year published, they're a Spanish group of researchers and physical therapists and physiotherapists, which brought together, again, sorted through all these hundreds of research studies that we have and graded the quality of that evidence and pulled apart the dosage of the evidence and the type of evidence that can be used. So coming out top, these are our top 3 exercise types of exercise that are appropriate at significantly increasing the frequency of migraine for people with migraine. So coming up top there, we have a moderate intensity continuous aerobic exercise. So that's a mouthful, but that's basically like fast walking, jogging, cycling, dancing, even things like that. This is an interesting one because it was shown to be effective for people who have episodic migraine, but also people with chronic migraine. So on the 2 ends of that spectrum. The frequency and the duration is what I kind of like you to kind of reflect on and think about, because for a lot of you, you might already be exercising, which is fantastic. So you can look at, okay, could I look at maybe increasing it a little bit, or could I look at other types of exercise to help supplement my management of my migraine through exercise? So in this particular group of studies, so this was a group of 12 studies in over 500 people. So there were frequency was 2 to 3 times per week for 30 to 50 minutes. So it's significantly long amount of time. And to be doing that type of exercise for 5 to 12 weeks. Now, you mightn't start at that. That's totally fine. There can be a bridge up to that dose, and then you're starting that dose. So you're thinking of it like you would if you've had conversations with your GP or neurologist or headache specialist, that it sometimes takes a bit of time to find the right drug that works for you, but also to find the right dose without giving you additional negative side effects. So for some people, you're not just a person with migraine, you're a person with migraine who might also have a sore knee, who might also have a sore back. So it's trying to navigate your way towards something like this optimal dosage. So second in line there was yoga, and I think that is commonly mentioned for headache and migraine, and with good reason. These particular studies, so I have there were 2 systematic reviews and 6 RCTs on over 400 people, but these were specifically people with episodic migraine, so on the lower end of that frequency of migraine. The 3 key elements to include within yoga are the physical aspect, so the asana, where there's an element of the stretch and the strength bit, the posture, the breath work component of it, or pranayama as they call it, and then the meditation or relaxation bit, the nice bit at the end, shavasana, where you just lie down and relax. So those 3 components are very important to have included within a yoga practice. This was done 3 to 7 times per week. slightly longer amount of time needed with it, so 60 to 75 minutes. And again, going up towards that 12-week duration. So again, similar to when you're starting a drug for migraine or looking in that, it's like give it 3 months and see how you're going with it. So it's in around that mark from here as well. Third, for that, then we have our mixed exercise and lifestyle strategies. So this is when we're combining two things. So we're combining different types of exercise, but also bringing that in with like optimizing your sleep, making sure that you are getting sufficient amount of food throughout the day. You're managing stress. So those two approaches together, and doing that 3 to 7 times per week. And again, I think that's 20 to 60 minutes. I can't actually read my own slides here because our thing is in the way, but you guys will be able to see it there. So that's the most important part. And again, it might be useful to take a screenshot of these and on the next slide as well, or come back to it when we have it on YouTube, where you can again reflect back on, okay, maybe I need to increase my dose of a particular type of exercise from here. And it's also important, I think to remember, and I think that when we say evidence-based practice, what we're talking about is the best evidence that we have or the best research, working with your clinician or your healthcare provider, but also what your own personal preference is. So if we're looking to maintain a long-term exercise strategy or management to helping managing your migraine, it really needs to be something that you're going to enjoy and that you're getting some kind of self-efficacy and some kind of inherent motivation within it as well. So, and I would kind of position that one as kind of the highest bit to try and keep that up, because there are other benefits, as we said, outside of improving your migraine to do an exercise. So the more, again, as physiotherapists, we're just big advocates for helping you start and maintain any type of exercise. And again, hopefully this will just give you an idea as to the different types. So coming on to another big slide here that's bringing us down. So these are also recommended for migraine, but the grade of the recommendation is a little bit lower, and that will be based on the number of studies, the quality of studies, the whole synthesis that they've had of all of these hundreds of research studies. So this, I think, is a really nice one, that exercise kind of can get a bit of a bad rap with, you need to be out of breath and you need to be huffing and puffing for you to get any kind of benefit to it. And with migraine, that is not the case, because relaxation exercises are very important and highly recommended tools to use. And they are exercises. So you are physically focusing on different areas of the body. So that could be through a guided muscle relaxation and deep diaphragmatic breathing exercises with it. And I think what is nice is that maybe if you are already exercising, that you could look at, okay, can I add in relaxation exercises to my management strategy? Or if you're like, my motivation is really, really low right now and I have no energy, I don't even feel like I can get up and go for a walk. You're like, well, relaxation exercises are a tool that you can use. And we have, I think there was 3 RCTs and over 300 people in these relaxation exercises. And again, the dosage is a little bit different because it's quite a large collection of it, but from 1 to 6 times per week, and from 15 minutes up to 2 hours, again up towards that 12 hours per week to see that that benefit. It can be done with biofeedback or not. So biofeedback being that you are monitoring some other kind of physiological marker. So it could be you're monitoring heart rate or your breathing rate. There's lots of different tools that can be used in that regard. So we have our relaxation exercises are a nice one that you can start to add in. On the other side of the scale then is HIIT, so our high intensity interval training. So this is kind of the one that's, you see it everywhere on social media, or it's kind of like seems to be the poster child for exercise, when really it's only a small little bit. The study done here, so we had 3 RCTs and over 130 people with this, but this was only in people with episodic migraine. So for people who have chronic, potentially more disabling migraine, this wouldn't be the first port of call for you with this. This would include, again, this is back to our aerobic side of things, of the heart rate is going up quite high. Here we're moving up into like 90 to 95% heart rate max. 2 to 3 times per week, and again up towards that 12-week mark. What is, I think, quite interesting with this Fitbit is that you get a lot of bang for your buck out of the exercise if you can tolerate it. It can be a much shorter duration. So usually it's done in like 3 to 4 minute blasts of an exercise. You have a bit of a break, and then you're maybe doing 3 or 4 minute exercises again, a break, and then another 3 or 4 minutes. And that could be mixed with weights. So you could be doing kettlebell type workout stuff or burpees and push up, lots of all the fun stuff. If that's your definition of fun. So I see Deirdre smiling there. So low intensity aerobic exercise, so coming right back down again. This is essentially walking. So we have a lot of walkers out there. One of the best form of exercise you can ever do, and strong evidence for it to help your migraine. So if you are someone who is walking, how often are you walking a week, and how long are you walking for? So that 40-minute mark seems to be where you need to kind of push it for it to be thought of as a preventative for bringing down your migraine frequency, duration, and severity. And here you're working at around that 60% heart rate max. So another way to think of that is that you can walk and talk, but you're a little bit breathless holding a conversation with somebody for that particular one. So again, reflecting on that for yourself. And then we have a mix of a few other ones. I'll go through these a bit quicker. A mix of different type of exercise. So it could be a mixed bag, lucky bag of stuff from here, combined with the relaxation one. So that might be one that you don't have a particular grow for one type of exercise. You like to mix it up. Good evidence for that as well. Again, that 2 to 3 times per week, but you might need to do it for a slightly longer amount of time in terms of duration. But again, up towards that 12 weeks. We then have strength training. So this would be, if you think of like, say, dumbbells or barbells or progressive loading through there. The only evidence we have for this so far is in people with episodic migraine. There's a little bit more potentially around vestibular migraine for strength training. There's other studies coming on, and I think we'll see more on this strength training element over the next few years. And this is measured a little bit differently in terms of intensity, in that you're going towards 1 rep max. So if you're doing a strength program and thinking of it for preventing migraine, it should be progressive in the strength. So you're building your strength up over a period of weeks. You're not doing the same exercises at the same weight, at the same reps continuously, or you're not going to get the benefit. And then finally, we also have evidence for Tai Chi and Qigong. I think that's how it's pronounced. So this would be a mixture of slow moving type of exercises, again with a similar, I suppose, inherent piece within them of bringing in that breathing and meditative focus with it from there. And again, moving up towards that 12-week mark, and anything from the frequency as well from there. So they're all the different types of exercise. Now I want us to talk about migraine threshold and your exercise capacity and tolerance. So the horizontal line there is our migraine threshold. So it's going to be slightly different for every single person, and you need to learn how to find that threshold yourself, or ideally you need to learn or find help to learn how to do that. So once your migraine threshold is reached, you're into that attack phase, and then you're going through those stages of a migraine attack. For people who are in a chronic phase, they might actually be living on that threshold or above it a lot of days of the month. For people who are episodic, in that 0 to 14, they're slightly below that threshold, and then something is triggering them up into that migraine threshold. It doesn't always have as easy an explanation as that, but this can be a big part of that picture. So for example, you could have certain triggers that I know my patients kind of find it frustrating as well, is that the same trigger doesn't always trigger an attack. But oftentimes, if we pull back through it, there can be an accumulation or a buildup of these triggers over a period of time. And so when you are making exercise decisions around this, it's important to consider, okay, how can I optimize my other lifestyle factors to raise my threshold slightly so that it's harder to set off a migraine attack with exercise? So this might be optimizing your sleep around it. It might be resolving underlying neck pain that's there, might be ensuring that you are maintaining adequate meals throughout the day, might be more mindful around menstruation, again, particularly for women when if you have a hormonal or a menstrually related migraine, that you are mindful of, okay, do I need to be sleeping more around that time of the month? Do I need additional fuel around that? Do I need to make different decisions on the type of exercise that I do around that time, and tracking that and managing that? So coming into our barriers for exercise for people with migraines. So as I said, I think it's in and around 28 to 56% of people with migraine have exercise as a trigger. So it's quite a significant factor. Understanding it as a threshold and how we can build towards that, and we'll go into more on that in the next slide as well, about how to make those decisions, is a significant barrier for people with exercise. So we're often told, and everyone says you should exercise, but there are different barriers for a person with migraine to exercise than someone who doesn't have migraine. So neck pain is very common in people with migraine. So between 30 to 70% of people who have migraine. So that can be a limiting factor. People with migraine can have comorbidities or other disabilities, or be extremely disabled by migraine attacks and how that develops. So your access to a safe place to exercise, or your ability to exercise on your own, can be different than somebody who doesn't have any underlying disability as well. Overall, people with migraine seem to have a lower baseline activity level. So this is important to remember. If you are starting an exercise class from zero and you go into a very high intensity class, your capacity for that might be lower than you think, and that can just be enough to push you up into that threshold for an attack. People with migraine again have greater bodily pain and injuries, and again this kind of comes into our comorbidities and that. So it's managing and trying to manage other areas of pain in your body while also navigating migraine. Looking towards low mood and energy levels, and this is just as simple as like having the energy and exercise. And if you are dealing with a fluctuating state of symptoms and of attacks, that can be harder to get into a routine to exercise and knowing what you should do, and then beating yourself up over the fact that you're not doing what you should be doing. So it can kind of come into a vicious cycle from there. Menstrual cycle changes. So again, for a lot of people, they can have true menstrual migraine or menstrually related migraine, and your migraine threshold will shift at particular times in your cycle. So it's really important to be tracking that or keeping track of that in your diary, in terms of making decisions around what exercise might be appropriate for you at what particular times of the month. There's more research around that now at the moment, but not to the phase that we can give blanket recommendations for what type of exercise you need to do at each particular time in your cycle. It's individual. So you need to become your own little scientist about this, to work out what is best for you. You can do it with, alongside a health professional as well, but a blanket statement that you should only do strength training at this stage in your cycle, only aerobic now, that is not the current state of affairs really with the research base for where we're at. Kinesiophobia, or fear of movement, is another big barrier for people with migraine. With people who have persistent pain, so from migraine or in different areas of their body, we move a little bit differently, and we can have so exercise can be a trigger, and also the fear of exercise being a trigger can impact how we move and decisions we make about how we should move. So that is also something to consider as well. Our self-efficacy, so our belief in ourselves, of our ability to do these particular things, and we might need more help to get across that bridge. So whether that's support groups, whether that's talking to people through Migraine Ireland, whether that's reaching out to other health professionals or your GP or that with it, but you're not alone in that. Like, these are things that are seen across all people with migraine. And the final one I have in there at the bottom there is around the environmental triggers. So particularly in gyms that can be really, really noisy, very bright lights, lots of people, different smells, different perfumes, body odors, things like that. They can be a trigger. So again, this is coming back to you being at certain times, whether that's in the month or depending on where your threshold is, those symptoms or that kind of phonophobia or photophobia might be slightly different at different times. So it's tuning into and being aware of that when you're making your decisions around what's most appropriate for you on that particular day. So a solution-based approach, because I've just gone through all of the bad stuff, all of the barriers. So, okay, what can we do? So slow and gradual, okay? Let's all think of the tortoise and even more conservative in how you start than you think. So even if this is particularly for chronic and then more towards our middle episodic people, and if you're very low frequency, then you don't have to be as strict on that. But as a rule of thumb, slow and gradual with it. So try and get consistent with the frequency of how often you're exercising for 1 month first before you think about adding in another additional day of exercise. Okay, so for example, if you're saying, okay, I'm going to start with 2 times a week, try and do that for 4 weeks and then look at bringing it into the 3 times a week or moving up and down from there. Be very mindful of your neck and your form and technique, and without overcomplicating it. What you want to think of in a general form is that when you are exercising, so particularly within exercise types of exercise that are either you're loading through your hands, so your hands are on the ground and you're using your shoulders, or you're using weights in your arms. So those two particular types can be a type of trigger. So what you want to do is to think of, okay, can I relax my shoulders? And can you keep, I'll show you a side on here for a bit of an example, keep a relatively neutral neck position. So keep your head over your shoulders. So it's just not out here. So those two basic things will help a lot with just not aggravating or not contributing to neck being a trigger for a migraine or an accumulation of that within your exercise plan. Try and sort out your other injuries and pains as well, because they can limit your exercise choice. So if you have, a knee problem and then that's limiting how much you can walk, then that has knock-on effects then to bringing your baseline activity level down that bit lower. So it doesn't directly cause a migraine, but it lowers your threshold for a migraine attack. Back to our relaxation and breathwork exercises. I use this a lot with my own patients because there can be, and I didn't say that on the other slide, a higher post-exercise sensitivity in people with migraine. So after exercising, for some reason, our nervous system is staying somewhat tighter or staying turned on. There's this somewhat inability and that hypersensitivity in our nervous system that it's not letting go or not relaxing. So adding in some relaxation or breathing exercises immediately or pretty soon after you have exercised can help your body recover or down-regulate the nervous system after having that ramp up of a positive stress response is what we want, but that it can go back down again. And so then that allows you better recovery within a session and then able to start another exercise from there. Really prioritize the logistics of how and what you're going to do. And people underestimate this, but having it in your diary, having it as an appointment, and allowing that to happen. But also, and this is where it gets tricky with migraine, is that having the flexibility that you don't absolutely have to do it on that day just because it's in the diary. If you are getting feedback from your body on that day so for example, like that photophobia, so your sensitivity to light, your sensitivity to noise, or allodynia, like sensitivity on your head to touch, or you're getting little signs like that, then maybe it mightn't be the best time to be going into a HIIT class. Okay, so you're just trying to have that flexibility within the system as well. What really works well from our health behavior research is that role of accountability. So having someone, particularly when you're starting back up exercise again, so having someone who you can, if you're not really in the mood for it or just feeling a bit low energy, that they'll be the person who'll get you out the door. You're like, I told them I'm going to meet them, so I better and meet them and go for a walk. So this is coming back. Then we use this a lot in physiotherapy around like having a traffic light system, and more so about our exercise response and bringing up. And this is where you are your own expert in your own body, and tuning into that will enable you to make more positive decisions, particularly around exercise choice. So headache isn't just going to be your only symptom. And again, by definition, migraine will have other features to it. So the green zone. So if we're in a 0 to 3, so you're pretty low. So other associated symptoms, and you have met all the other kind of, you're well fueled, you've good hydration. So this is on a daily assessment that you'll be doing, and you're like, okay, you know what, I'm able to go for a moderate or a high intensity workout today. But then maybe 3 days later, you've booked into that same class again, but today, it's maybe the day before your period. You had to work late last night at work, and you're a bit stressed about it, so sleep wasn't great. And so it mightn't be the best choice on that particular day to do a more high intensity workout with it. So it might be, okay, you know what, you could go maybe into that workout class and just do a lower intensity version and maybe not do the strong bit at the end. Or you could just choose to do some gentle yoga or go for a walk, or be like, today is not the day. I'm just going to do some relaxation exercises instead. And I suppose the key bit with it is to not beat yourself up about it, and to that it's not you being lazy with it, it's you tuning into the feedback that your body is giving you and you believing that feedback with it as well. And I think that's really important when we're looking at the long term, the longevity of your exercise choices from there. So if you are returning to exercise after a period of time off, so this could be that you have had a really bad run of it with migraine, or for some other reason or other, you've not been exercising regularly. So these are the main areas that I think are important to focus on. So start at 50% of where you finished up. Okay, so if you used to go maybe for a 40-minute moderate intensity walk, just start off with the 20-minute walk. Okay, so half that could be in terms of the duration, or in terms of if you're in an exercise class that you're doing 50% of the weight instead of what you would have finished up. So say if you used to use like a 12 kg kettlebell, going for like the 6 kg. So just as a rule of thumb, it's a nice place to start with it, because you need to build up your exercise capacity, and your nervous system needs to get used to this new stressor again. Having a social accountability element to it is really important, again, for getting us out the door. Having the social interaction bit is actually really important for our nervous system as well. So I'd really try and include that where you could. Diary, so I'm a really big advocate for this. More so on the like planning it and the training diary and marking it in and being like, okay, I did this amount around this intensity, my symptoms were this after it and on the next day. So we're always told you should be keeping headache diaries. Anyone you go into, to be like, where's your headache diary? And that can be great, and it is really useful to monitor certain things in our drug responses and things like that as well. But it can be a bit depressing if you're getting headache every day. So trying to flip it a little bit and trying to have it as like a training diary, so that you're like, okay, well, on this day, I did my relaxation exercises, I did a 20-minute walk, I did my symptoms, how did my body respond to that? And also, as women, bringing in our cycle or cycle changes within that, if we are in that particular phase of our life. Rehab your other injuries. Again, I think that's just important, because it can limit what other types of exercise you can do. So just try and resolve those if possible. Easier said than done, I know. And on the last bit, which I think is important to bring in, is to this is for when you're restarting exercise or returning to exercise, is to prioritize your recovery. And especially as someone with migraine, you really want to help your nervous system respond in a positive way to the stress of exercise. So, do you know how much sleep that you as an individual need? And you're trying to get that. So, for some people, it's 7 hours, some people, it's 7.5, sometimes it's 8. It's a spectrum, and you want to try and okay, if you know it's 8, then you're like, okay, I need to be in bed for 8.5 or 9 hours to hit that 8 hours of sleep that I need. And you're really focusing on that. So you're trying to raise your threshold for a migraine attack. The other thing that we see, again, more so in clinic, and there's some research on it, is that sometimes people try and do the two things at once. So they think about weight loss and bringing in exercise together, and it's just not a nice mix to start off with for exercise. So what's more important is that you are adequately fueled with food and water. And that's a really, really important factor with that. Because you need fuel to exercise, and your brain especially needs fuel. And if it loses that fuel within that exercise, so if it's not having enough fuel or fluid, it's more than likely that you're going to have some kind of a negative response to that exercise. So finishing up on Marie, so we'll come back into her. So again, this is a patient who she started boot camp and she was wondering if this was possibly triggering her migraine. And she's previously been able to walk. So what we looked at was looking at her neck involvement. Again, this isn't for everybody, but for some people, their neck can be one of their triggers for a migraine. So we looked at resolving her neck and an old rotator cuff type of problem there through manual therapy and through rehabilitation exercises. So exercises that you could do at home. We then tried to bring in, so we have what the research recommends, and then we have what's realistic and practical within that person's life. So Marie felt very time poor, so she didn't have like a 40-minute block that she could do in the evening after school because she was running around bringing her kids everywhere. So we got a compromise. Okay, can we try and go for that moderate intensity exercise at 20 minutes on the lunch break? And she did that with another teacher in the school. So she was getting in that dose of it, and she was getting it in pretty much the 5 days of the week, but allowing some flexibility if she didn't. So you can meet the recommendations in different ways. For the boot camp type class, we reviewed her type of exercises that she was doing. So certain squats, how she was doing like a burpee type of exercise, how she was doing overhead exercises. And again, looking at relaxed neck and shoulders and just keeping her head over her body instead of in front. So in broad terms, that will cover a lot of it. Ensuring that she was having enough water and food on those particular days, and then gradually going back into the boot camp class. So you don't have to be the winner in the camp class or that with it. So it can be, that people in the class, they don't mind. You can have it at a lower level. Everyone is concentrating on themselves. And then we also brought in the traffic light system with her as well. So for those particular days, and as we kind of pulled apart her triggers, to realize that there was more of a menstrual component to her threshold changing. So within that, she just pulled back a little bit on her exercise choice, again, tuning into have I more light sensitivity on that day, or more stress in and around that, or around the sleep. So it's thinking of your exercise choice in relation to how well bolstered up am I by my lifestyle factors as well. And that's pretty much coming to the end of it now. So on a quick summary, that exercise can decrease migraine frequency, duration, severity, and migraine burden. It can also help lots of other things. So again, our mental health, bone density, particularly as women, and as we get older, that's a really important factor to bring in, and strength training is a really good way to do that. Optimizing your sleep, and again, this can also help with mood and our cardiovascular health. Different forms of exercise can be used. There's lots of different ones that we can use there. Understanding your own barriers can help you problem solve how you can help bring more exercise into your life. Understanding that threshold for a migraine can help you in your decision making around it. And again, that traffic light system that we have gone through there. And oh, there's my own little dinger there. I'm 5 seconds off. Um, so as well as the headache diary, I recommend training diary and an exercise type of diary. So for to track it in, but also to track the positives. Okay, because it's not all doom and gloom.